Hi, my name is Caitlin Jones, and this is my lab video for exercise 2, the axial and appendicular skeleton. And this here is Pedro, and he's going to be my skeleton model to help identify all the parts. This is Pedro's cranium, the frontal bone, the parietal bone, the temporal bones, the zygomatic process, the mastoid process, the occipital bone, the foramen magnum, the occipital protuberance, the superior orbital fissure, the inferior orbital fissure, the lacrimal bones, the lacrimal fossa, the maxilla, the zygomatic bone, and the hard palate. Then on the top, we have 4 sutures. We have the corianal suture, the lambdoidal suture, the squamosal suture, the sagittal suture. Then we go to the mandible. We have the ramus and the body of the mandible. We have the angle of the mandible, the mandibular condyle, the coronoid process, and the mandibular notch. On Pedro, we have the hyoid bone. We're going to talk about the vertebrae. So the first region is the cervical region. The atlas is the first cervical vertebrae. The axis is the second cervical vertebrae. Then we have the thoracic region, the lumbar region, and the sacrum. Then we have parts of the vertebrae. So first we have the body. Then we have the spinous process, the transverse process, the transverse foramen, the whole, the intervertebral foramen, and the intervertebral disc. We next have the manubrium, the body, the xiphoid process, and then the first 7 ribs are the true ribs, and ribs 8 through 12 are the false ribs. Here is the clavicle with the sternal and acromion ends, the acromion clavicular joint. Then we have the scapula, the glenoid cavity, the acromion process, the spine, the infraspinous fossa, the supraspinous fossa, and the subscapular fossa. This is the head of the humerus, the greater tubercle, the lesser tubercle, the coronoid fossa, the olecranon fossa, the lateral epicondyle, the medial epicondyle, the radius, the ulna, the olecranon process, the carpal bones, the metacarpals, and the proximal, middle, and distal phalanges. Here we have the iliac crest, the iliac fossa, the anterior superior iliac spine, the sacroiliac joint, also known as the hip joint, the ischial tuberosity, the pubic symphysis, the acetabulum, and the obturator foramen. Here we have the head of the femur, the neck, the greater trochanter, the lesser trochanter, the lateral epicondyle, the medial epicondyle, the patella surface. Below we have the tibia, the anterior crest, the tibial tuberosity, the medial malleolus, we have the fibula, and the lateral malleolus, the talus, the calcaneus, the metatarsals, and then the proximal, middle, and distal phalanges. This concludes my lab video for exercise 2. Thank you for watching.